Hi everyone, my name is Madison Dodsworth. I'm a past Morrison intern who is currently working as a dietitian in a clinical inpatient setting, but I'm happy to share what it's like to be a clinical intern during this rotation. So each week you are going to be assigned a new RD and a unit to work under, so learning that preceptor's specialty, starting with general medicine and moving more into specific disease states throughout the progression of the rotation. So as a clinical intern, each day is going to mimic the day of the preceptor that you're with, and everyone doing things a little bit differently, but generally the flow is going to be the same. No matter what, your day is always going to start with screening patients, so seeing who needs to be seen that day in the units that you're covering. So looking for any nutrition consults, any length of stays, any follow-ups that have been ordered, or any malnutrition screens that might have come in, but compiling the list of who you need to see. And then from there, you can sit down with your preceptor and figure out which ones you're going to be in charge of for the day. So who are you going to talk to out of that list and do the assessments for, which will vary depending on your progress throughout the rotation. But from there, once you have the list of patients that you're going to be seeing, you can then independently sit down and sort through the EMRs of each patient, gathering all relevant information needed to do an assessment, so figuring out what's going on with the patient. And then from there, once you've gathered all the information you can from the chart, you get to then go speak to the patient and interview them and gain any information that you weren't able to get prior, which also might entail having to speak to nursing staff or talking to other interdisciplinary teams like speech pathologists, or possibly going to unit rounds depending on what unit you're covering that week. But once you've done all that and gathered everything you need, you can then compile all that information into a chart note, into a full nutrition assessment on the patient, and from there you can sit down and show your preceptor what you came up with, and they can help determine and make sure that the intervention that you concluded was correct. And from there they can sign the note and also order anything needed for the patient during their admission. So any nutrition support orders, any supplements, any follow-ups needed, or possibly labs, just depending what assessment was done. And then you're good to go. And with clinicals, the days are always so busy and there's always room to work ahead. So you'll definitely never be bored when you're in your clinical rotation.